Hi, I'm Dr. O.
And I'm Dr. Amy.
We're both certified animal chiropractors. We're certified by the American Veterinary Chiropractic Association.
We're also veterinarians. We both went to veterinary school at accredited colleges.
And today, we're fortunate enough to be here in Wiley, Texas, at Double B Equestrian Center. And we'd like to thank Rick and all the boarders that are gracious enough to let us work on their horses today. Hi, I'm Dr. O, and today we're going to look at a performance horse. This is a barrel racing horse we're going to look at today, but any performance, no matter what your discipline is, can benefit from chiropractic care. This guy ran 3 weeks ago. He's competing in the top level of open barrel races. Just not quite given the competition that his owner thinks he should be able to give her. And so we're going to take a look and see maybe if we can't find some chiropractic problems that we can correct and help this guy bring out the best in himself and his rider so that their performance is going to be better. And remember that these little things, when the horse moves, it takes every muscle, every ligament, every tendon, every joint, and every bone in their body to move. And so if we have a problem in one, it gets compounded. And if we don't take care of these, then eventually we'll end up with some problems like in the lower limbs. We'll end up with some problems maybe metabolically that are going to end up with maybe early retirement for this horse. So what we're going to do is we're going to take a look at this guy and introduce ourselves to him. And I just have a food treat here. And we're going to see how well he likes it. We're going to try to get him to eat off his shoulder. And remember, a horse is a prey animal, so they should be able to come around 360 degrees and get this treat. And as you can see, he's just not quite able to do that over here. He just can't quite get it. So let's turn him around, and we'll try the other side. Okay. So we have the same treat. And he just can't quite get this one either. So we know he's having some problems with his neck. Now, let's go around over here. Stay right, keep him right. And we'll take a look at his back. Okay? So, his back should bounce. And when I put pressure in top here, you can see that his belly bounces. Okay? When I come back here, which should be the most fluid area of his body, and I put pressure there, there is no bounce. His body doesn't bounce like it should. So we know he has a problem here with movement. And if I ask him to collect, what I'm going to do here, this is a reflex action. So when I get hit with a rubber mallet, my leg kicks. And it's automatic. It's not that it hurts. It's just a nervous system reflex. When I tickle him right here, he should collect. And he's trying. He's real uneasy, and he's not coming up very high. So that means that he's very inefficient in transferring energy from his back end, where the energy is generated in a horse, and it has to travel out the front end. And when this lack of movement in here makes that very inefficient. So even though he's been doing great, he's doing his job, he's performing on an everyday basis like he should be, he's got several problems that we can probably, hopefully, take care of with chiropractic care that will help him perform even better. So let's go adjust him, and we'll be back in just a minute.
Hi, I'm Dr. O, and today we're going to look at some footprints in the sand and see what footprints can tell us. Remember, a horse should have two footprints if he moves correctly. He should have a footprint on the left side and a footprint on the right side. This horse does. Here's a right print and a left footprint and a right print and a left. And if we look at these right prints here, we can see that as this horse comes forward, he's dragging his toe. He's knocked the dirt down here. Okay? When we look at the other one, we have a nice clear footprint on the front. He's not dragging his toe here. let's go take a look and see if that's truly what our horse is doing. Now we'll have Dr. Amy walk Rowdy by us and watch his feet. Watch how the left rear comes up and the right one doesn't come up as high. He's kind of making a little dust pile every time he walks. So as we bring Rowdy in here and we're going to take a look at him, the interesting thing about Rowdy is that Rowdy has a history of having a shoulder injury that has occurred several years ago. And if we ride Rowdy 2-3 days in a row, he'll come up acutely lame on his left front. But we see a problem in the right rear today. How come? Well, remember, when a horse moves, it takes every muscle, every ligament, every tendon, every joint, and every bone in his body to take one step. And if everything's not moving correctly, it will cause a compensation or a problem in another area. If his front legs aren't moving a full stride every time, then his back legs can't move a full stride every time, because otherwise he'd walk in a circle. If the front end is only doing 1.5, then the back end has to do 1.5. It can't do 2 full strides. So as we look at his pelvis, and we'll try to get him around here to where we can see that on camera. Look at him from behind, and his feet are square on the bottom, and his pelvis is uneven on top. One side's higher than the other. So we know that this is incorrect. We know that his symmetry is off from front to back. If we ask him to do a neck stretch for us, we'll see that his mobility on the front end is very limited. Come over to the other side and ask him to go this way. We can see that his mobility is very uneven. Okay. It's worse on the left than it is on the right. So would be some problems with his left shoulder, left side of his neck, with the right hip. And this is something that we see a lot of. We get called to look at these horses that have known injuries, and the owner wants us to take care of this shoulder. Well, we really don't know what happened to this shoulder years ago. We weren't there. We weren't called to look at it. They have explained to us that we've x-rayed everything from here down. We've done nerve blocks, all the diagnostic tests that needed to be done, and they all came back normal. So there's something going on here. It doesn't seem to bother him if we just ride him a day or two, but then all these compensations that have occurred on his daily living, okay, start to get the better of him, and that's when he becomes acutely lame. Now see, he sure wants to come back here and look at me, but notice how his head is twisting again. So, and if we ask Rowdy to give us a little butt tuck, we notice that he's not standing square in the back end, because he can't stand square on the back end comfortably. His pelvis is high on the right side, low on the left. We ask him to give us a butt tuck and do some collections, and there's just not a whole lot going on there. So this guy is definitely having some problems from that injury, and a reason that there's several things we can do to help Rowdy, or any horse that's had previous injuries. One thing we can do is use Sornomor. Sornomor is a cooling liniment, and so we can actually use it underneath the saddle. We can put it underneath our saddle pad over here on this shoulder. We can also put it underneath the saddle on his back, because there's some heat here. So it's going to be a cooling liniment. It's going to help him move better. So on these second and third days, if we start using the Sornomor on day one, maybe we can prolong how long he'll be able to work comfortably. Another thing that we can do is use a product like Cetal M. Cetal M comes in 2 forms. It comes in a joint cream, and because we've blocked everything here and we know that all these joints are normal, I would put the joint cream on his shoulder. The other thing we could do to not only help the shoulder injury, but to help the pelvis and all these back, and especially to help in the pole area, would be I would put him on the Cetal M, the oral stuff. Okay, this is going to help. It's a glucosamine. It's going to help lubricate the joints. It's going to help prevent arthritis, and it's going to help with degenerative joint disease, preventing the degenerative joint disease from compounding itself. Because once a joint starts into the degenerative joint process, we need to remember that it's an inflammation. And once the inflammation cascade starts, it's a vicious cycle, and it just keeps going and going. And we need to be on some sort of anti-inflammatory, some sort of product that's going to help stop that inflammation cascade and keep it from getting worse. Chiropractic care will help that, so will some of these products. Another thing that works really well would be a back on track saddle pad, which is going to be ceramic fibers. So it will be increased circulation to the back and to the shoulder area, because everything underneath the saddle pad will get increased circulation. So that's going to help Rowdy heal and help him do better as we ride him and ask him to perform. Let's go ahead and adjust Rowdy. We'll come back and take a look and see how he does. All right, we're going to ask Dr. Amy to walk Rowdy back in again after his adjustment. Notice that his hind feet, they're both coming up off the ground a little bit better, a little bit more even in the pelvis movement. Remember, this is one joint, one adjustment on a horse that's had some problems going on for several years. As we bring him back in here, we can ask him to collect again. And he's got some movement in his back now. He comes up in the back, and as we bring him around over here and ask him to come around and give us some neck motion. He's not sure if he wants to treat. Oh, there it is. And he can come almost all the way around. So we've taken this horse that was moving a little incorrectly from a previous injury. We've helped restore some normal motion to this guy, and we've helped harmonize your horse's health.